This episode has been supported by Almirall. At Almirall, we are driven by science and committed to providing innovative solutions that address unmet needs and improve the lives of people with skin conditions. Hello and welcome to another episode of EUROPSO Podcast. I'm your host, Jelena Misita. I'm a patient advocate, and today we are diving into the world of psoriasis from two unique perspectives. We have two remarkable guests with us, a patient, Tina Koukopoulou, and a healthcare professional, Dr Martina Burlando. She's from Italy, and we will hear more from them about them. For now, our episode is about unveiling psoriasis, providing double perspective on this, but from a particular angle, which is a female angle and family angle. So without further ado, I would like to begin with our patient guest, Tina. And Tina, can you briefly introduce yourself and give us a little bit more information about your background?
Hello, I'm Tina. I come from Greece, from the north part actually, Thessaloniki, and I'm a patient with psoriasis since the age of 16, and currently I am 49 and I have developed psoriatic arthritis as well, and I was diagnosed with psoriatic arthritis 4 years ago. I am a patient advocate for the Pan-Hellenic Association of Patients with Psoriasis and Psoriatic Arthritis Epidermia, and I am also a proud member of the EUROPSO board, the pan-European umbrella.
Sounds impressive. Even when you list it like this, I can only imagine how it feels working on this every day and being so occupied. So Tina, could you share with us how psoriasis affected your family and your close ones when you found out you had psoriasis?
Okay, initially when I found out that I had psoriasis, I was only 16. And to be honest, it was a very mild psoriasis. So even though I was lucky enough to have the proper diagnosis from day number 1, the disease did not affect my life at the early years. It was many years later when the psoriasis became severe, when the symptoms became serious, when my life was really truly affected. Now, when it comes to family, you know how people always say that patients with psoriasis had to face stigma and all that. The truth is that when it comes to your close ones, your family, your friends, it's not the stigma, because they are aware of the fact that psoriasis is not contagious. They are not afraid to coexist with you. But the main issue, especially with family members and life partners and everything, is that they really truly do care about you, and they want to be next to you throughout your whole journey with the disease, and subsequently they learn about the disease, and they know that, for example, your therapeutical option might harm your autoimmune system and that you have to be extra very careful, and they also have to be very careful as well, because they don't want you to have to get ill so often. Moreover, sometimes in different treatment options, you have restrictions like food restrictions, or alcohol is not allowed, and your family always has to take care of that. They are part of the problem, and they come with you to the doctor's appointment, and they take notes, and they are extremely sensitive when it comes to derma diseases. So if you are lucky enough, like I am, and have a very close family, then it goes with the territory, the fact that they will care, and they will try to be as informed as possible, and they will always look after you.
So you mentioned at the beginning that psoriasis was not full-blown at the beginning, but it gradually progressed, and it affected more and more your life, your daily life. So can you give us some sense, some feeling of how this disease impacted your overall well-being, both physically and mentally? And are there any social implications in particular because you are a woman? Did you experience something like that?
Of course, I have experienced stigma. I'm not an exception to any rule. So 3 out of 4 patients worldwide who are diagnosed with psoriasis have experienced stigma once in their lifetime. I'm no exception. I was thrown out of gyms. I was thrown out of hair salons due to the fact that people could not recognize the disease. I mean, even if they heard at some point in their life that psoriasis is not contagious, that doesn't necessarily mean that they could identify the skin lesions that I had, which were very visible, and jump into the conclusion that nothing will happen. So unfortunately, due to lack of awareness, due to lack of information, I received a lot of stigma, and this is one of the main reasons I started and made this decision to be an advocate, a patient's advocate. And it's not easy. You know, we are women. Unfortunately, we live in an era where image is important. And I live in Greece. Greece is a country with high temperatures. Women tend to wear, short sleeves or shirts, and a lot of skin is shown. This is very difficult for a patient like me because, I do have lesions on my legs. And for me, I always wear trousers. Due to that fact, you will never see me on a dress unless it's a very long one. And at some point, for example, when I had a rebound effect from a treatment and I was 95% covered, psoriasis was so visible, and I had to be functional. I had to go to work so everybody could see that there was something wrong with my skin. And now that I work with patients, now that I represent patients and I represent patient associations, I have the inner strength to go out and say that I have psoriasis and I have accepted the condition. I have been on national television saying that I'm a patient with psoriasis, but that was so not always the case. And it's up to every single person to decide if and when he or she wants to share the condition that they have. But when it comes to derma diseases, this is not the case because the skin lesions are out there and everyone can see it. So whether it is vitiligo or it is atopic dermatitis, psoriasis, hidradenitis, all the diseases, it's easy to see that there is something wrong with someone's skin. Hence the stigma.
Do you believe there are differences in the way psoriasis affects women compared to men? I mean, obviously, women are more sensitized for this topic, but do you think men feel it less, or are they equally insecure about this?
I think it has to do with the culture, and unfortunately the answer is yes, that women are more affected by the disease, and unfortunately women are more linked to the image, to the whole standards of you have to look nice and be beautiful and take care of yourself. And even though theoretically we're all equal, in real life men don't care that much about their image, and they are not that sensitive. Some of them are. I'm not saying that everybody is, but in general, I think it's way harder for women.
Yeah, it feels like that. I mean, I'm a woman, so it feels that anything that happens to my skin makes me extra insecure and reluctant to wear clothes that I like usually to wear. So do you think that having a condition like this, even though people think it's only a skin disease, no drama about it, but these are only uneducated people who don't know what psoriasis really is, and that is not only skin deep. So now that we know that this is a systemic disease, that it's not skin deep, it affects multiple organs and it affects the whole body of the patient. Do you think this condition influences family planning for some people, some women, or influences their family dynamics? What do you think about that?
Well, it's always up to the person, but I do understand, for example, if you're a woman and you want to have kids, that your husband might have second thoughts in terms of whether the kid will also have psoriasis. Or, for example, if you have psoriatic arthritis, Sometimes you have pain in your joints, stiffness, and some movements are very hard, and it's way more difficult to have kids. And even though we know nowadays that there are treatments that allow women to have babies, and psoriasis should not be the reason why a woman should decide not to have babies, the truth is that sometimes it crosses your mind, doesn't it? That, okay, I have been through all that trouble and I have tried very hard to, fight with all the symptoms of the disease. And do I want that for my kids? Or will my kids have psoriasis? This is not necessarily the case. For example, me, for all these years that I've been going to the doctor and always the same question, does anyone from your family has psoriasis? The answer from me was no. I was telling the truth until the day that my mom became 60 years old. That's when she had psoriasis for the first time. So she had me when she was like 23, and after the age of 60, she has psoriasis. So you never know. And moreover, I'm thinking, my grandfather was born in 1911. At these years, who would bother to go to a dermatologist and, bother to ask about some skin lesions? I mean, I am wondering whether people had psoriasis in my family, but they were never been diagnosed due to the fact that now things are different. Access to specialists is easier, and treatment options are way better and more.
Tina, you strike me as a force of nature. You really do. I mean, I know you even outside of this podcast, and you are so energetic, so vibrant, so always ready to talk, ready to help, ready to advocate for this. So it seems to me that you know a secret, and I would like you to share the secret with everyone. What is your personal coping strategy with managing challenges of psoriasis? How do you do it? How do you stay so positive?
The strategy comes from the patient association, and the secret is, do you have psoriasis? So are we. The feeling that you're not alone, the feeling that you belong, the feeling that there are so many people who are facing the same problems and who are dealing with the same symptoms, and the feeling that there are so many other patients like you makes you feel that you're not alone, you're not that unlucky, and that you should fight to live a better life.
Thank you, Tina. This is really enlightening. What can I say? I'm really privileged to have this talk with you, and for you to share your personal experiences with us. I think it's brave. It shows us why are you the patient advocate that you are. So thank you for now. Now I think we would like to hear from our healthcare professional, Dr. Martina Burlando. You're expert actually in 3 different areas. Can you please tell us a little bit more about this?
Yes, of course, with pleasure. My name is Martina Burlando. I come from Italy, from Genova, in the north part of Italy. I'm 45 years old, and I'm a specialist in psoriasis, psoriatic arthritis, and HS, Hidradenitis suppurativa. So I'm quite an expert of chronic disease, because it's important, according to me, it's important to deal with chronic disease and to create a collaboration with the patient, because unfortunately, speaking about the dermatologic part of this disease, they have a great impact on the quality of life of our patient. And this disease, like psoriasis, like HS, of course, all the life of our patient, and healthcare must be able and capable to follow their patient and to help them, because, sometimes these diseases have relapses, and it's quite difficult, because sometimes you win against the disease, sometimes you don't. But you have always be at the side of the patient to help him to face the disease. So that's why I like to deal with chronic disease, because it's a very challenge for me.
Well, chronic diseases are sometimes lifelong challenges also for patients. So it gives us confidence that someone is dedicating professional life to something that is lifelong condition for others. From your medical perspective, we talked with Tina about well-being and assessing well-being while suffering from psoriasis. In particular, I think it's difficult to do this in times of flare-ups, but how do you assess as a healthcare professional impact of psoriasis on women's well-being, considering physical, mental, social aspects, everything that Tina already mentioned?
Yes. Well, thank you for the question. To tell the truth, at first, when I performed my first visit, when I met the patient for the first time, I'm focused just on the PASI score, on the severity of the disease and the quality of life. I don't look at the social impact that psoriasis has on the patient. The first time I'm like that. So I'm focused on the disease, but in the term of the severity of the disease. Because for me, the first important thing is to remove, to cure the psoriasis, of course. But sometimes we know from literature, we know also from a lot of study that even though the patient reach complete remission is not satisfying because the well-being is something more than just related to the PASI score, to remove from the body psoriasis. It is related also to the fact that he can return to a normal life, that he can have a normal social life. So it's just something related to the PASI score. The well-being is something that it's cover a lot of aspects of the patient life. And of course, it's important also to take consideration if the patient is a woman or is a man, because we have to treat our patient considering everything related to our patient.
Yes, this sounds like a good approach, all-around approach. And sometimes, it's not enough. I know from some other therapeutic areas that when it comes to medication, for example, there are drugs for stroke, for example, that are on the market, but they have been tested in studies conducted with white men 60 years of age. And in reality, stroke happens to women over 75 years of age, of all colors, not just white. So does something like a stratification, gender-specific approach or stratification exist in this area, in psoriasis? Are there approaches or treatment strategies for women in particular, or is it same for both sexes?
Well, speaking about therapies, there is not a real strategies. I think it's something that it's related to the healthcare professional. Every healthcare professional has his own sensitivity when he's face to face to a patient and he considers if he's a man or a woman. Of course, I think that as I'm a woman facing with a patient that is a woman, it's easier to have a collaboration because usually a patient looking at a healthcare professional, a woman healthcare professional, maybe feel to be more understood than a man healthcare professional. So it's easier for me to create a collaboration and also to find if I can maybe profile to make some therapies suitable more for the woman than for a man. So of course it depends from case to case. There is not a very strategy worldwide that we use for women and the strategy that we use for men. It depends on the healthcare professional and on his sensitivity.
How do healthcare professionals in general address the family impact and family planning? We talked about this with Tina, and I'm interested to hear medical professionals' perspective. How is this being addressed? Family planning concerns and doubts that patients have, like Tina mentioned before.
Well, yes, usually when I have to face with a woman, I always ask above all if they are on childbearing age, if they have kids or if they want to become pregnant, because it's important because, we have to collaborate and we have to organize if they want to have child, because there are therapies that are not, of course, that you can't use in patients that want to become mom. There are some therapies that you can use. They are quite safe. So it's important to speak about pregnancy, about any family planning. Always I visit my patient entirely, and also I look for psoriasis maybe in genital area. It's difficult to treat area like genitals because I think that genitals psoriasis has a very big impact on the sexual life and in general on the behavior of the patient. So it's very important when I think about the family, or when I have a patient in front of me, I always make a lot of questions. And of course, it's what Tina said, it's very important because sometimes you are afraid that your child could have your same disease, and it's quite normal, but we know that we can't say yes for sure, because we know that of course it's a hereditary disease, but it's not a direct, if you have the psoriasis, it's not so strong related also that also your son will have psoriasis. It can happen, but usually what I suggest to my patients not to have fear about that, because you can deal it, we can manage it. So you have just to feel free to have a pregnancy, and we will also cure eventually the psoriasis, also if it will happen to the baby. It's very complex, of course, management of a mom in a childbearing age, because I know that there are a lot of fear. You are very afraid about the disease. When it appears and it happens to you, you are afraid. But when it happens also to your child, maybe you feel responsible of that disease. But there are a lot of therapies now, so we can manage. Nowadays we can manage.
So what I'm hearing from you is collaboration. Underneath everything is collaboration between doctor and patient. So could you maybe shed more light? There is obviously shared decision making. A lot of decisions have to be made about therapy, about going further, etc., etc. So could you shed light on collaborative efforts between patients and healthcare professionals in managing psoriasis and promoting overall well-being?
Well, collaboration, I think it's the important part of a relationship with a patient, because it's important to speak about the therapies, eventually any side effects, decide together which is the best therapy, because maybe according to me, a therapy is the best for that patient. But speaking with the patient, I understood that he has a kind of life, that type of drug is not enough, is not suitable. So I have to change. So the most important thing is to speak, and to speak freely. So I have to speak to the patient and discuss with him the available therapies, but also the patient must feel free to discuss any problem, any question he has, she has, because we have to find together the best therapy. Of course, I think that also for a good collaboration, it's important to have, it's like a mix, it's like a recipe, like a cake. So you must have empathy from the healthcare. Of course, the healthcare professional must be also put a lot of experience. There is also a little bit of lucky, because, sometimes you can also organize everything, but you haven't relapsed. And sometimes when psoriasis relapse, you can't always think about it. You can't think that, of course, it will relapse, but you can't organize it. So you also have a little bit of lucky. And also the patient must be patient, because chronic psoriasis is a chronic disease. And so we have really to have a mix of these things to really create a straight collaboration.
Well, I think you summarized it quite nicely. I mean, what you just said can be taken as takeaway messages from today's talk. But if you need to boil it down to one thing, what would be your key recommendation for patients, except to be patient?
Well, I suggest to the patient to be positive, as nowadays psoriasis is very treatable. I think that the patient should be elastic, because we have said that psoriasis is a chronic disease, but even if you have flare, of course, you can manage them. And I think also that the patient should be open to their healthcare professional, because they really can help them. So psoriasis is a very long journey, but if you can create a collaboration with your healthcare professional, the journey will be easier, and the healthcare professional will be with you day by day at your side.
Thank you. Tina, do you have any questions for our doctor here? I can sense that you want to ask something.
First of all, I want to say that I agree, because communication is the key when it comes to the relationship between the doctor and the patient. And shared decision making does not mean by any way that the patient should choose the treatment. It's the doctor's part to choose the right treatment, but the patient has to communicate the special needs that he has, what kind of treatment suits him in terms of following it properly, and share the fears, share what they are feeling, so that a relationship of trust can be built between the patient and the doctor. And in this way, the best treatment for each patient will be chosen by the doctor. I heard what Dr. Burlando said, and I think she shared very valuable input with us today. And I understand that at some point you mentioned PASI. And what I want to say is that when it comes to skin diseases, especially psoriasis, it doesn't necessarily has to do with the percentage of coverage that you have in your body, but it also has to do with the location of the lesions. For example, a female patient might hesitate to go to the beach, or might be reluctant when it comes to sexual life due to the location of the lesions. So the question might as well be, where are your lesions located? So my question is, how important is that, especially for a woman, to have psoriasis on the genital area, or to have psoriasis on the face, for example, and how that can be a huge barrier for the patient in order to move on and have a good quality of life. So the question is, would the healthcare professionals be more bold, more aggressive when it comes to treatment options when you have special locations of psoriasis?
Well, Tina, thank you so much for your question. Of course, I want to reply that I need to start from something. And of course, PASI score, so the severity of this disease, it's the first thing. But of course, then I go deeper, because I always visit my patient internally. I ask him or her to take off their clothes. So I look at the nails, I look at the hair, I look at the genital area, I look at everything. So, of course, according to me, the severity is not just related to the PASI score. The severity is also when there is just one big patch of psoriasis on the face, or in the hair, or also in the genital, or in the angles, because, it's very difficult to face with this kind of psoriasis. So I just mentioned PASI because as a healthcare, I have to start from something. I have to have fixed point. But after all, of course, I go through the entire patient, not only physically, but also mentally. I always ask the patient, what do you want from the therapy? What do you expect from me? How can I help you? I think that it's the best way to make a collaboration, to us together, to find together the right therapy. Of course, the last choice is mine because I know all the type of drugs, but sometimes I can change my idea according to a drug, because maybe I think that a drug is useful for that patient because I think that the drug is very fast acting, but the patient is, he has a work that jobs that travel a lot, so maybe I can't perform that kind of therapy because I have to move from something that is easy to perform every 12 weeks and not every 2 weeks. So sometimes I change idea, of course, depending on the patient I have in front.
That makes sense. Thank you very much for your answer. And I would very much like to ask you one more question, if you don't mind.
Oh, of course, with pleasure.
In our patient associations, even though we have seen patients making a huge difference when it comes to quality of life and the clinical image of the disease, if that's the right term. And take me, for example, I was covered and now I'm practically almost clean. Even though there are people like me, we have a lot of patients who are afraid of the side effects, and they are aware of the fact that there are numerous treatments available, but they hesitate what would you suggest to them? What would you say to them in order to prompt them and so that they can face their fears? Thank you.
Oh, thank you for the question. Well, it's quite normal that a patient have fear about a therapy. I usually go deep in that fear because I ask the patient why you are fear about that therapy. Because maybe someone that you know have a problem, and so I ask about that because sometimes their fear are not really related to the drug. So I want to understand, it's a real fear about the drug, or it's a fear about something else, maybe because they have a friend of them that have psoriasis and then had a side effect, but not related to that therapy, just a side effect. But they try to generalize because they have fear about their disease, and so they are afraid about everything. If they are just afraid of my disease because they don't know about the therapy, I explain the therapy. And also I suggest my patient to make a lot of follow-up according about his fear. If you are very afraid about the side effects, maybe you can plan our follow-up visit closer than normal, may perform blood exams, so you feel safer. I always try to understand the fear of my patient, to go deep about their fear and to resolve them. And so it's quite easy. We can try to go over.
Thank you very much. So once again, communication is the key, correct?
Yes, communication is the key.
Well, if you both agree, I think the key takeaway from this whole conversation is that good communication leads to good relationship between doctor and patient, which leads to better outcomes of treatment. I think this is a straightforward way, and I think it's easy, but sometimes it's easier said than done. It's a long journey, but we are slowly getting there, I think. So thank you, Tina. Thank you, Dr. Burlando, for sharing your perspectives and experiences with us. And for our listeners, I would like to remind you that living with psoriasis presents unique challenges, but with support, understanding, and right guidance, it's a journey that can be managed. So if you find this episode informative, please subscribe to EUROPSO's YouTube channel. We'll be back soon with more enlightening discussions. Until next time, take care and stay healthy. Thank you. Bye-bye.
Thank you.
Thank you.
This episode has been supported by Almirall. At Almirall, we are driven by science and committed to providing innovative solutions that address unmet needs and improve the lives of people with skin conditions.